Our knees are constantly enduring stress and strain. Always keep in mind that these joints bear the full load of your upper body and every pound of your weight. We bend them, twist them, sit on them, and shift positions continuously. We walk on them, run on them, they're in constant use. Given all this, our knee joints absolutely cry out for some gentle, devoted care. So, whether you're currently dealing with a diagnosed knee issue or some form of discomfort, I'm about to share a technique that is not only highly effective, but also completely safe, and I will walk you through exactly why that is. And even if you're symptom-free right now, I strongly encourage you to put this to the test. Try what I'm about to demonstrate, both before and after, and I promise you will notice an incredible difference. Just because your knees aren't hurting doesn't necessarily mean they are operating at their peak potential. They might be functioning at 90% or maybe 80%. But with this simple method we are going to perform, our goal is to restore proper mobility directly within the kneecap itself. So, I'm going to use my own knee as a model. Let me talk a little bit about the anatomy and mechanics involved. And here's a part I think you're really going to appreciate. Over the years, I have dedicated a significant amount of time to working with major athletes, particularly focusing on their extremities, and there's so much we can learn from biomechanics in that context. Fundamentally, the knee is basically a simple hinge joint. However, if that hinge joint isn't moving through its proper range of motion, it can set off a chain reaction, leading to other problems in the body. So let's do a quick review. The kneecap, or patella, is a free-floating bone that rests over the lower portion of the femur. As we walk, it moves up and down along a specific track that sits behind it. Now, for this demonstration, I'm using this table so I can face you directly, giving you a front view, while I show you from a slight angle exactly what I'm going to do. That way you can follow along with me in real time, and this could make a truly significant difference for you. Now let's look inside the knee. We have these cushioning structures, our discs, which are the menisci. There's the medial meniscus on the inner side and the lateral meniscus on the outer side. The primary function of that patella, that floating bone, is to protect the knee joint. It also serves as a crucial attachment point for the quadriceps muscles. When we contract our thigh muscles, for instance, when we're getting up from a seated position, those muscles pull on the top of the kneecap. So when we bend our knee, that kneecap needs to move and glide smoothly. But here's where the problem often lies. If the muscles on the inside of our knee, the front of our knee, the outside of our thigh, all of these various muscles that encompass and support the knee joint, if they aren't in perfect balance, it can throw the alignment of the patella off track. That kneecap is supposed to travel up and down within a specific groove. So if you take your fingers, we'll use our thumbs for this, keep your leg straight, and move it up and down like this, it should glide quite easily. But it should also glide when you move it side to side. See, right now, for me, it's not gliding well in this particular direction. However, it moves well up and down, and it moves well toward the inside. Ideally, it should move in this angle too. In fact, the kneecap should be capable of moving in 8 different directions. For me, it moves well down to the bottom right on that angle, but on this side, not so much. Moving it toward the outside of my kneecap isn't happening very smoothly. So, my main issue is with these 2 specific directions. This is precisely what we're going to address. We're simply going to introduce movement back into the kneecap. Why? Because for millions of people struggling with knee issues, the root of the problem could actually be referred from the kneecap itself. If we can just restore that essential movement, allowing the kneecap to function with proper biomechanics, then the other muscles and the other parts of the joint will be able to start working naturally again. Always remember that every time we experience a knee issue, or any issue in the body for that matter, there is always a primary cause. If that primary cause isn't functioning correctly, if it's locked up or restricted, then other joints and muscles are forced to compensate. That's when we start developing more problems, because whenever we're dealing with an injury, a chronic condition, or even a long-term problem, and this holds true even if you're not currently in pain, there is always that underlying primary cause. So here's what we are going to do. I'm going to take hold of the kneecap, and we're going to challenge it. As I push in, we'll give a few little impulses going downward just to ensure it's moving properly. Okay, now you want to make sure your leg is completely straight. With the leg straight, the surrounding muscles are fully relaxed. I'm going to pull the kneecap upward and give it a little impulse, just like this. Then, I'm going to move to the inner diagonal, this way. You see, it's already starting to move. All right, now I'm going to come this way. On me, it's a little locked up, but there it goes. You might feel a slight impulse, and you might even hear a little noise, a bit of a pop or click, which is just the movement returning. Now, our objective here, and I want to be very clear, is not to adjust joints or bones like a chiropractor would. The goal is simply to free up movement by applying these tiny, gentle impulses. So, when you do this, don't force it. Just go easy. As I come out this way, I just give a little impulse. And I'm going to come to this angle and then back in this angle. Just kind of grab around it and then a little impulse. Now, this should never cause you pain. When I went in that one direction, I heard a little crepitus, that crackling sound, and I felt a little movement that wasn't there before. That area was clearly fixated or not moving as it should. Now, what you'll likely notice when you start freeing up the kneecap is that before you begin, one area or two or maybe three areas, as you go through all the directions up and down, side to side, angle, inside angle, diagonal, and both diagonals, you'll discover a few spots that aren't moving correctly initially. They're just locked. They aren't moving. So when you apply that little impulse to the area that's restricted, you're freeing up that motion. And by freeing up that motion, you're freeing up the overall function of the joint. And I can tell you from many stories over the years, but I'll share one last one that's quite remarkable. A friend of mine, who is a neurologist, was actually scheduled for surgery because he was suffering from debilitating knee pain. He came to see me, and I checked the motion of his kneecap. We looked at his knee and found two specific areas that were locked up. We simply applied a little motion to those areas, and to this day he is perfectly normal and pain-free. This illustrates that no matter what condition we think we have, it might not be what it seems. For example, we might think a problem is coming from a disc in our lower back, a herniated or bulging disc, but it might actually be stemming from the sacroiliac joint or from an imbalance in the muscles. But for the knee, the primary focus is this. You're going to put the kneecap through these different movements. Check which areas aren't moving as you go through all 8 directions: up, down, lateral, medial, and the 4 diagonals. You may notice, hey, it's not moving in that position. So all you do is take the kneecap, push it to the point of tension, and then give a little impulse. That's all it is, a tiny impulse. It should not hurt, but many of you may feel a little pop or a click simply because it was locked. And the beautiful thing about the human body is that when a joint is fixated or isn't moving correctly, and you then apply movement and restore that motion, guess what happens? It's now yours. It's all yours. The joint is free. What I'm really emphasizing here is that you or anyone else could have these fixations, this loss of movement in a joint, particularly the knee joint, for years and years. Maybe it started because one hip has been sitting higher than the other, perhaps from an old fall or an injury. Maybe it's from the way you walk, or if you're carrying extra weight. Maybe it's from working in an awkward position, like being bent over as a mechanic. But regardless of the cause, you want to go ahead and check both knee joints. I promise you, you might just be the happiest person in the world after this. You're going to say, wow, I feel all this tingling in there. Everything has freed up. You might notice that the knee pain you were having just dissipates and goes away. The clicking you used to experience might just stop. The meniscus problem you thought you had might no longer hurt. It's a wonderful thing. So I truly hope that you will take this knowledge, value it, and treasure it. Use it, play with it. Remember, the process is simple. It's all about taking the tension out, then a little impulse. Taking the tension out, little impulse. Taking the tension out, little impulse. You are simply restoring movement. This isn't about me teaching you how to perform adjustments. It's about restoring movement, restoring function, restoring health, and ultimately restoring happiness so you can feel pain-free. I hope you've enjoyed this video. Please take the time to do this, even if you have no pain at all. Just check your joints, check your knee, the kneecap, and you're gonna say, wow, I never knew it wasn't moving like that. And then put that little movement in there, that little impulse. You're going to say, wow, that gives a little tingling, that hyperemia, that rush of blood supply feels good. It frees up and feels so much lighter. And when you start to get up and walk, things will feel so much different. Do both kneecaps. Check them both out. And please, share this with someone who could benefit from it. I wish you all good health. Make it a great day. I'm Dr. Alan Mandell.